Though the positivity rate, Professor Mukherjee, has gone up from about 1.1% at the start of the year, it's now about 11-12%. Should we be looking at test positivity rate, given that there is a huge question mark over testing itself, or should we be looking at hospitalization rates? As you mentioned, hospitalization much lower this time than during the Delta wave. Should the focus be on hospitalizations? So long as hospitalizations are under control, we remain relatively in control of this third wave.
Yeah, ideally in an utopian world where you have the perfect data, I'd completely agree with you that we need to really focus on hospitalization rates. But we do not have hospitalization data uniformly available across India. If we did have that, the rate of hospitalization for COVID and with COVID, because we do know that there is a lot of incidental COVID discoveries in the hospital, but people who are for COVID, if we had that granularity of numbers and what is the capacity available of ICU beds, hospital beds, ventilators, if we could track that data nationally, then I completely agree with you. But we do not have that data, and just the test positivity rate and the RT-PCR test is all we have nationally. So I still think that it is important as sort of a surrogate marker, not the perfect marker. And I completely agree that we should have new dashboards. In a vaccinated population, the case curve is not always predictive of fatalities and hospitalization. So we should really have dashboards which report these things daily at every state, at every union level, so we can track the magnitude of the pandemic better. Not just that, we can tune our public health interventions accordingly without overkill or an under-pitched intervention.
You know, at the moment, the states which I'm looking at where COVID cases have gone up are Delhi, Maharashtra, West Bengal, Tamil Nadu, Kerala, Karnataka. You seem to suggest that while these areas could peak in the next 7 to 10 days, new areas will emerge. Now, the worry is that many of these are the election battleground states where vaccination levels are much lower, let's say in a Punjab compared to in a Mumbai or a Delhi. Is that a worry for you that maybe the next wave within this wave will be in some of the states that are lesser vaccinated outside the big cities?
So this is an excellent point, because vaccination is the key, because you see that so many people are sick right now, but thank God, or thanks to public health and thanks to science and thanks to vaccines, that very few have to go to the hospital. So the situation looks very different from second wave, because the immunity wall or the immunity quilt of India has changed substantially with natural infection plus vaccination. If you look at data from other countries, the Omicron-related hospitalization, a large fraction of that is in the unvaccinated. So in the battleground states, in the states with lower vaccination, I'll strongly urge people to get vaccinated, and till then to use COVID-appropriate behavior. But I am very concerned about the next realm of states that are rising, and we already see, if we have the daily tracker, we see Bihar and Rajasthan and Uttar Pradesh, many of the states actually rising with an R value around 1.9 and 2, and I am concerned about what is going to happen with the healthcare capacity.